So Travis Grant, I'm the health industry lead for Accenture. We run a fairly diverse set of consulting services across the health industry here and around the world.
Amazing. Definitely know of Accenture. But I know Accenture does a lot in healthcare. I'd love for you to explain that a little bit more about the different things you do in healthcare.
So a lot of people probably think of Accenture in technology, and certainly our bread and butter, where we've built and run the My Health record for the last sort of 10 plus years, as an example. But we do electronic medical record work. There's a lot of data analytics work, but many people probably don't realise the breadth of the work that happens as well. So we get into new operating models for public and private providers. A lot of work with private health insurers. So it is incredibly diverse, really.
Yeah, interesting. In terms of those insight, what you do with all of that then, because there'd be an incredible amount of insights, capability, I guess, understanding what the trends are within the ecosystem. How do you, I guess, explain some of the outcomes or outputs, or I guess the state of healthcare innovation within Australia or globally at the moment?
It's moving at a rate of knots. It's funny, if you reflect back over the last sort of 10, 20 years, I remember hoping that the health industry was going to get to this point of digital transformation. And it is just growing so rapidly. And the role of technology is massive now, but it's only going to get bigger. I think the key that we find is you just have to be super close to your clients and understand what the client issues are, and then sort of matching some of the local and the global innovations that are happening and trying to make them real, because there's a lot of hype about certain things as well. So the challenge, I think, sometimes is really trying to cut through some of that hype and coming up with things that are practical for clients as well, based on what they need today.
Yeah. And to understand that a little bit more, then, when we talk about clients and I guess problems to solve and where their priorities are, what are those common kind of buckets of who those clients are in terms of, are we talking about healthcare policymakers, or is it on the those running the health systems? And maybe we can pick one or two of those avatars. But then, where are their biggest concerns, pain points? Because I can make some assumptions about, there's all such a cool suite of technology that's now available to deploy, but they're kind of, what's the why? I'd love to get some insight.
Yeah. I think the challenge we've got at the moment is it is such an incredibly complex ecosystem.
Yeah.
If you're a government, so which problem do you want to solve, right? So primary care, aged care, disability, mental health, it is really quite complex. And, with aging population, it's very expensive to run as well. If you then translate that down into the providers, both the public and the private providers probably haven't had it as painful as they do today. It is really tough. So access is a challenge. Cost is a challenge. And then if you cut across perhaps into the private health insurers, so they're trying to figure out how do they balance their role in the ecosystem as well. We've got some structural challenges. So it is very tough if you're a government leader or a provider or a payer. A board member or a C-level leader is really, really difficult right now.
Yeah, it's a not so fun choose your own adventure right now. But there's hope, and there's some good opportunities there in terms of emerging technologies. We're all excited about AI and large language models. But what about you? Where are you seeing some of the best bits of tech coming through that are, I guess, resonating or taking the interests of clients?
So it's pretty diverse. I think our healthcare system, we have to get the basics right first. So there's a lot of clients who are really putting in base technologies, right? So getting the digital core right. So a lot of work on HR systems. So that's quite common at the moment. Electronic medical records if you're a provider, or claims solutions if you're a payer. So there's a lot of work happening in that sort of the core of the organisations as well. And then I think at the front end, I think omni-channel work. So you're trying to come up with the best possible patient or member experience across, regardless of the channel. So that's quite a hot topic as well. But I think if you get those foundations in place, that's when you get good data, and that's when you can get some value out of AI, let alone Gen AI. Right? So that I think is the key. It's how you stage this in the right way.
Yeah, we've got to get the walking first before we do the
experiment still, right? And there's really good examples of experimentation in AI and Gen AI, which you can scale now. But it's really trying to get the balance right, so you get the outcomes and trying to balance the financials at the same time. So it's not easy.
Very true. You're up on the big stage later this week, aren't you?
Wednesday morning.
Yeah. We're here at HIC. So what will you be talking about there?
So we'll be talking about care reinvention, which is consulting speak for how do we solve the clinician workforce problem. So we've got over 100,000 nursing roles that are short at the moment. So we're just short nurses, and it's a massive problem globally. 13 million nurses short globally. And the challenge is over the time, it's not going to be enough just to try and train more nurses. I think the opportunity is to try and come up with a role that is actually great for a nurse, so that they have great job satisfaction. The experience is great as well.
Yeah.
So the key is reimagining how the teams operate. Take out the waste from clinicians, where appropriate, pass them to non-clinicians. Use technology in a number of different ways. So automation, proper technology foundations. There is a role for AI. There's a role for robotic process automation. And if we do that in the right way, we'll come up with workforce roles that are actually, great roles. So that nurses, for example, want to work in the system, and we'll do it cheaper as well.
This is a super important topic, and it's one that we've covered a bit because it's, as you say, a global issue in terms of clinician shortages generally, but nursing in particular. And I think, or at least from a doctor side of things, where like Australia compared to other parts of the world, where it's still a big issue, but there's other parts that are feeling it even more so. So it's not like we can just do better at trying to convince clinicians to come to Australia, because we're actually doing that. But on one hand, there's clinicians, nurses in particular, within the healthcare system that kind of start to go above and beyond and trying to looking for that career progression and really having an impact. And I think it's great that there's organizations, consulting firms and everything that people look at and diversifying their careers out. But then we kind of want to keep as many nurses within the system to actually do the job. And I know that and it's not that people are leaving and because they don't care or they don't want to, but it's just not a pleasant kind of place to be. So that's a big bridge to gap. And I guess typically of my understanding too, this is a long question, but it's me just venting. But on one side, from the consulting side, there's some opportunity for decision makers, I guess, from the top end to be able to create that environment for clinicians to have a good workplace. But I feel like there's a really important role for those on the front line to be able to feel like they can have a voice, or that they can, if they see an opportunity for an innovation, that they can be in a space where they can raise their hand up. So I guess where I was heading with it is that, where do you see the bigger impact in terms of, is this change that needs to come from the top, or is there a need for more nurses to get their hand up?
Yeah, the real challenge is you need a lot of ingredients for it to work and for it to be sustained. So first, you need it to be clinician driven. And that's across, both the doctors and the nurses and all the representative groups. The challenge, you need a lot of the C-level playing their role too. So you're really looking at comprehensive operating model changes in order to take some of the waste out of a nurse's role and provide it to a non-clinician, in order to introduce technology in a way that is sustainable, but also to reconstruct that operating model that doesn't cost more money. It means you need COO, you need CIO, you need the CFO all to buy into it. Chief medical officer needs to be involved. So they have a role to play, but if it's not clinically led, it won't be sustained.
Yeah. Hey, lastly, perhaps following your session on Wednesday here at HIC, what are you hoping that people do with that information? Because it's sometimes I find it, often at any event, it's like you take information in, you're like, this is good, and then you get back to the grind. Like, what are you hoping that the biggest takeaway will be? So if you actually look in a lot of the media these days, you see a lot of media, you see a lot of organisations shining the light on the problem, and there's good clarity, I think, on what the problem looks like. What I think we need to realise is that there are solutions around, and there is proven ways that this can be done, but it's difficult. But I think regardless of what role you might have, whether you're a senior leader or with your clinician, there is a role you can play
to inspire people around you in order to drive a change agenda. And I think that's the key. We need the sector to realise that there's solutions here, but it's we have to get on that and do it. Otherwise, we're going to have a health system that's going to continue to struggle.
Yeah.